I'd like to call resources back. Dr. Kennedy, if you could give up your chair for and maybe just move back there. Commissioner Smith. Commissioner, do you need to step out or can you come up? And again, I apologize, but if you said it in your opening or say
Victoria Grady, HHSC rate setting.
Victoria. So if you may have said it in your opening, but to what extent, you've now heard some of this testimony, right? Do you want to respond to it in terms of thank you for, you could respond by saying, hey, thank you all for willing to sit with us and maybe help us figure this out a little better. Or, no, guys, we talked to a lot of people out there, a lot of dentists, a lot of orthodontists. I mean, what's a...
Well, I would say thank you for all the comments that we received yesterday. We had 28 speakers at the hearing. We've also received hundreds of comments through our email process and through fax. And we count all comments the same, whether they're received at a hearing or whether we receive them electronically, because we don't want people to have to shut down their business, drive to Austin to participate in the process. So we look at all of the feedback, and our staff are back at the office right now, working through all of those comments and finding.
But I want to ask you, to what extent did you do that before you made this list? To what extent did you reach out and talk to providers and get that kind of input? Because yesterday was about give us comments on what you think we're proposing. I'm asking to what extent did you engage with stakeholders, et cetera, in trying to figure out before you did the list?
Well, I think part of that we can go back and find out exactly who staff talked to. I can say that I personally, we've talked to the heads of the dental managed care organizations about this process from the standpoint of looking at our pay-for-quality program that we are created with the DMOs. We've talked about, rates that we would be setting in the future, not specifically these particular rates because this is a separate process. But one of the things that I've continued to talk to them about, and I will continue to talk to people about, is that the agency, in my opinion, is still trying to determine the proper rates. And every year, from as best as I can recall, since the carve-in 2012 of dental, the rates have continued to go down. Because from a first point is that when they were setting the rates, it was based upon what the expenditures were. Because you look at your historical data, and they were trying to assume what the proper rates should be. And that first year, they realized that the rates were set, and the rebates and the profits associated with that. Second year, the agency had a significant cut and a reduction in those rates, and that has continued. My conversation that I've had with some of the leadership and representatives from the dental MCOs, we've also had conversations about the sealants and those type of things as we're setting the rates. And so I heard about some of the preventative care. And one of the things that I'm hearing is that, and as well as our internal dental staff who are having conversation with their dental directors, is when you're looking at the number of children who are still eligible for those type of procedures, was the concern with, because they've gone through and they've applied sealants on a lot of those children, is that you can't come back and redo sealants the following year and the following year and the following year, because the population of children who are eligible for that type of procedure declines. And so we're making adjustments with that. And so when you start seeing some of the changes associated with it, it's because we are getting that different type of feedback through different channels, through whether it's through Medicaid or in staff that are coming to me. From this process, what we seek, and I'm definitely open to it, I meet with people all the time, multiple times throughout the day, where they come in and will share the impacts and what's occurring. I've had several meetings with some of the orthodontists who are looking at some of the more extreme dental malfacial issues and the Medicaid reimbursement rate associated with those and those dental procedures. And so we're looking at all of that, and we're taking that information in. And as we move forward with this process, is, again, the whole point is to try and make sure that we pay what we believe is the appropriate rate based upon today's need and what we're looking to get. And so we're going to try and make sure that that's where we land. And part of that is getting the feedback from the stakeholders and the providers into what the ramifications are on any changes that we are proposing, and to ensure that we have proper networks and that you have physicians that are in the networks and providers and so forth. And we're going to make sure that we do that. And that's going to be our continued focus. But I will say that as we look at our most recent year, and Mr. Chairman, one of the things I wanted to point out for the Medicaid dental rates, the total all funds number in capitated payments was $1.279 billion. The proposed rates in this proposal, again subject to final being finalized, is $1.23 billion. We're looking at about $40 billion difference there.
Million.
40 million. I'm sorry. Yes, thank you very much. I get caught up in the B's. $40 million difference there, and when we look at what the level of effort was, and even with the administrative fee that the agency paid the medical dental providers in 2016, and their profit before their experience rebate, there was still another $55 million in profit there. And so while what we're dealing with is to making sure that what we're paying in capitated payments is sufficient to pay for the services that are being provided, and to make sure that we right size where those numbers are.
And what I would say is that I didn't hear you say, and we visited with providers. I heard you say we visited with the MCOs, the heads of their whatever. Although I heard you say...
I did meet with some providers, yes, sir.
Okay.
That was the orthodontist that I was talking about.
Okay.
Those were providers.
All right. And so I guess where I'm going is let's make sure we get as much input as we can. If people, like these three folks who came up here, can help you figure out how to get the savings that you're trying to get to without making things worse for kids or making things worse for our bottom line long term. And let me say, after all these years, one of the hardest things to accomplish here at this Capitol is to get the legislature to do things today that will save us money in the long term. It's just one of the hardest things, because that if it means you got to spend a little bit more, but you can save over 10 years, another $1 billion, it's just one of those really hard things to get done. But if they can help you figure out how to get to your savings while also keeping your eye on preventive. We know in healthcare preventive is so important, right? All across the board. So that's all I'd say.
Absolutely.
Give them a chance to look at their comments, their emails, and all that. But take a real good look at, what is this going to mean for the kids that we're trying to help, and what is it going to mean for preventive measures that can save us more dollars down the line, so that we don't have to be asking you to cut even more, or that you're coming to us and saying, look, I just need more, because all of a sudden we've got these, these very acute issues popping up because we didn't do the right things 2 and 3 and 4 years ago. You see what I'm saying?
I do. I understand fully, and that's exactly what we're going to do. My position, as I've talked to you about state hospitals and others, is on cost avoidance and being able to do that up front. And we're going to make sure that we are consistent with that. And we did have conversations with staff we did talk about preventative measures, because we want to make sure we're incentivizing that.
That's right.
early
Just a quick question through the numbers. You said 1.3 billion is our annual or biannual pay for the and this is for dental.
The dental rate for Medicaid, this does not include CHIP, was $1.279 billion in 2017,
And you know
the
how many-
proposed rate is $1.23 billion.
How many people were served with the 1.3 billion? Rough.
Well, this would be Medicaid, and so you would have all of the individuals that would, about 4.1 million.
4.1 million.
Less than 4.1 million. The number of children in Medicaid, I believe, is about 3.5 million, and so that would be that we'd be looking at in this capacity.
Okay.
You have the
So I
exact
hadn't
number?
done it on the
I don't
calculator.
have the number of clients, I have the number of providers.
But assuming all of those are receiving services,
Medicaid recipients, all of them.
assuming all of those, I mean, and the percentage we said was 65% of those are actually receiving services. Is that right? So of the ones that are receiving services, I'm way lost in the math, but if I do it, it's going to be almost $500 a kid per year is what we're spending. Well, I was just trying to, I think that's right if you do 1.3 billion divided by 65% of, I'll check the math, but I think that's pretty close. It's a lot more than just preventative, I guess, because we're hitting
Well, if you want an
Sure,
average,
I want
Sealant.
to correct my
they can
math
get us that.
Yeah.
one aspect. We have about 354,000 children in CHIP, which is outside of this, and these are Medicaid dental rates, and these would be for Medicaid recipients.
Okay. But yeah, I was just trying
And
to
so
figure
that's
out
adults and
what
children.
we are investing, and it looks to me like we're investing nearly $500 per child per year on dentistry for the, that's just the kids that participate. It'd be closer to 300 for,
I'll see if I actually have that number.
is that wrong, 1.3 billion?
Well, what do we?
Oh, okay. I'm sorry.
Let's try to get the real number, okay? We'll get a breakdown for you. All right. I'm sorry, Ms. Rose?
Thank you, Mr. Chairman. I was just going to ask if we could also break that down to foster care and, because foster care children are included in that, correct? Okay. Thank
Okay,
you. Just
so
want to
when you
make
do the
that distinction
breakdown-
as well, yeah.
Break that down for us, too. All right.
Thank you.
Thank you all very much. Thank you all, and if you'll stay right there. Well, you stay right there. I don't know about you. I want to talk a little bit about Rider 219, and then the 1115 waiver, and I think we're done.